bar is always straight. This is a nice curve. But you know, curves and bars go together after 10 p.m. So I guess there is a justification sitting there. Oh, and happy Valentine's Day, everybody, by the way, for those of you who are not so romantically inclined like I am at this age. And what we've also moved on to realize is that anatomy is far better seen by a transvaginal view, and that newer 3D techniques can help us nicely. For instance, this is a beautiful Meckel-Gruber at 11.5 weeks of gestation. So this is what we will talk about and move on later in pregnancy. Then there are those mothers who've had a previous problem and they want to know the answers as soon as possible. And in that situation, you can give them a very early reassurance. And then you know there is the genetics story. Then there is the syndrome and the second opinion story. And that gives you enough time to do all the shopping, to do all the jumping around, to catch hold of the right geneticist, and then go home and make up their minds. Then they will consult everybody and everybody. And then, of course, like you heard that wonderful story a little while ago, what do people do with closed spinal neural tube defects? In the northern part of the contamination can actually be identified earlier in gestation. And we have a very good answer. Follow-up protocols, checklists, reporting formats, scans before 11 weeks of gestation, and technology. And then we will talk a little more about what is the hurry. So we try and see what are the causes. One, of course, is that the brain is small and you can't pick up these structures. The second is that there is an embryological timetable. Structures haven't formed. There is no corpus callosum. How will you pick it up? And then, of course, all the fluid spaces have not unnecessarily increased in size. And so how are you going to pick them up? Then, of course, there is something that we must understand, that some also identify most of the Joubert at this time, as this one turned out to be, because the ventricular system doesn't look good, and we will discuss that.
On our screening planes, and therefore normality of the anterior complex or the cavum septum pellucidum gives us a lot of reassurance about many other structures in the brain. Okay, so you need to understand that it is encompassed by the developing corpus callosum. So again, this is the corpus callosum, a sheet, right, connecting one part of the brain to the other in one view, because it's a 3D structure. In the sagittal view, it will look like a band because you're taking a section right in the middle, and in the coronal section, it's going to look like a tiny small wedge in here, okay, just above the cavum septum pellucidum. Right, simple. So you have the anterior commissure, the posterior, the hippocampal commissure, and the corpus callosum that is coming on the top. Now, why are we not talking about anterior commissures and hippocampal commissure on our ultrasound? What are commissures again? They are tracts, right? Can you see the tracts? When will you see the tracts? When there is a lining. So if you have a pia mater or a pia mater over it, you will see it as a bright lining. But axons, they are not myelinated in fetal life, only towards the end. So you're not going to see these axons particularly very prominently, and therefore corpus callosum, because it is the largest one and you have a covering of pia mater over it. So if you look at the corpus callosum, the in-between is hypoechoic. The tract is actually hypoechoic. It is above and below that, that is splenium. Okay, this is your cavum septum pellucidum. This is the splenium. And to be very honest, I don't look at this on all my scans. I like to look at the corpus callosum in the sag view itself, but this is one view that has been described to look at the posterior complex. Now, imaging of the midline, your anterior complex you've seen in the axial view. How should it look? Interhemispheric fissure is coming. It has to be interrupted by this bit. Okay, this is the clue. It's the simplest of all clues. Sometimes you have a very
blue, and the thickest portion of the corpus callosum is the splenium. So between the body and the splenium, you have the frontal lobes has got a visual region, which is occipital, the visual region, which is controlled by the rostrum. Genu is that which connects both the cerebral hemispheres. The fourth, the rostral, is a portion of the lateral ventricle which connects the temporal, the occipital, and the anterior horns. And that's the reason when you have a corpus callosum agenesis, you have a ventriculomegaly, because the splenium fibers connects with the atrium and the lateral ventricles, which gives rise to the ventriculomegaly. So this is the embryology. This is a typical 18 weeks. You find there is no splenium, whereas at 22.
So much from her I think more of how to talk to your patient. I think all those MRCOGs, etc., is another thing, and you should see her talking to a patient. The confidence that she can give a patient, or you can direct a patient to a particular. I always remember one thing, and it's not often that you get when you're sitting alone and she'll just tell you, Akshata, it is the patient who is important. Forget about everything else. And coming from a government hospital background, this is not something that you often hear. We were in a very different zone when I came out of my PG, and being with her, seeing her talk to the patient really changed my way of dealing with my own patient. So thank you very much.
Talking, because every time I'd come inside, and because I was really not paying attention. The only loss I've had in this entire conference is I have not been able to sit and attend any of the sessions, and just peeping in every session I was feeling jealous of all the delegates because just now I came from the cardiology echocardiography workshop, and there also nobody is even looking up. They're all in one huddle. They're being taught stick and everything. And similarly this workshop, thank you so much. It really was a success because of all of you, and all the delegates were sitting through this and looking like school students. So,
and your team has
yes, hats off to my team, because I would also like to clap for them, because really I've been able to do whatever I wanted, because everyone's saying single-handedly. I said no, I have like 34 hands, I think. So we have with us two very senior people.
Thank you so very much.
Thank you very much.
Thank you so much.
And the woman, please. Thank you. Now that moment has already come for all of us.
And people are so comfortable in their skin, basically. That's most important. We are learning, we are gossiping, we are enjoying, and we are really learning in the morning, isn't it? Our workshop was a hit actually. It was totally. And we all enjoyed. We nobody was in a running time. Any time खत्म हुआ ये हुआ. वैसा कुछ भी tension ही नहीं था.
Professor in a medical college in Pune, and she has taken time off to come and train herself in fetal medicine, and she's with us for 6 months here in Hyderabad. We are also very proud to have you here, ma'am, because it's really humbling. Like I said, you have to learn from these seniors, because at every stage in life we are students, and for us to take time off from work and come and retrain ourselves, it shows the depth of your your reverence to education. So thank you everybody, and yes, I'm going to cherish this photo.